Of course, no discussion of alpha-gal syndrome would be complete without mention of ticks. I'm no tick expert, but what I've learned over the years are that tick bites can be confused with lots of different bites. For whatever reason, we tend to blame spiders a lot for various bites that we don't know the etiology of, and certainly that can occur. But in other instances, spiders might not be the source, and it certainly could be tick bites. Not all tick bites are recalled, and this has shown up time and time again in the infectious diseases literature, where people test positive for Rocky Mountain spotted fever but have no recollection of a tick bite. So if someone is outdoorsy and has exposure in their hobbies or work or life and don't recall a tick bite but have symptoms that are consistent, then certainly testing for alpha-gal syndrome or alpha-gal IgE would be reasonable. So the other part of this that we've found over the years is that the site where the tick has attached in many patients, it seems in my practice well over 90% of patients who go on to develop alpha-gal syndrome, they report that the site of the tick bite will be red, itchy, inflamed, slow to heal. Some will even say that there's a hard knot almost underneath the site of the tick bite. And even fewer, but it comes up, people will say that the site of the bite is the first place that itches during the beginning stages of a reaction. So stay vigilant for tick bites that create what appear to be a hypersensitivity response in the skin. And be aware too that sometimes what patients will call chigger bites may in fact be bites from seed ticks or larval ticks that are so small they're very difficult to see. And also know that tick bites are not always recalled.